everyone. We can go ahead and get started. I'm so glad to see so many of you logged in. This is Michele Melnick, our board certified reflexologist, to come and share some of her techniques with you to hopefully help reduce some of the stress in your world. So Michele, we're happy to have you. And if I could just ask if everybody stays muted, if you could mute yourselves, and if you're not sure how to do that, I'll go through and do that from the back end. We will have different segments at the end of each segment. Michele will pause and see if there's any questions. So you guys will have a chance to ask any questions. And if you don't have time for your specific question, you're welcome to send her an email at the end of the presentation, or whenever. Her email address is included in the login instruction email that I sent you. So feel free to reach out to her independently as well. So I welcome Michele, and you can go ahead and get started. Thanks so much.
Awesome. Thank you, Lisa, for the introduction. So as Lisa said, I'm Michele Melnick. I am a reflexologist. I have been a reflexologist since about 2010. I am board certified by a national organization, and also for the last 2 years, I'm serving on the board of the National Reflexology Association based in the United States. I also am a nurse by training and have been a nurse since the 19 whenevers. And I like integrating the reflexology with nursing a little bit. So let me tell you a little bit about reflexology. It's the science that believes that there are areas in the hands, the feet, and the ears that correspond to different glands, organs, and parts of the body. When you put pressure on these specific areas, it elicits a response within the body. And what it does is it helps make the nerve impulses more efficient, makes the blood flow more efficient, and it also helps the body return to homeostasis, which is its natural state, and it helps the body heal itself. So while reflexology will not cure anything, what it does is it gets the body back to where it needs to be so that the body can work on healing itself, which is what the body does the best. There are some contraindications for reflexology. If you ask 10 reflexologists about contraindications, you'll probably get 12 different answers. But for the most part, the contraindications are active blood clots. If somebody has diabetes, we would work more frequently, but less time and much more gently. There's also a contraindication for the first trimester of pregnancy. And of course, if there are any fractures of the hands, the wrists, the arms, the legs, you would work on a different limb. Also, any type of open sores or cuts, any warts, anything that's oozing, we would also avoid working on that. But remember, if you've got a sore on one hand, you can work on the other hand, and you can also work on the limbs too. So we can talk a little bit about stress also. So stress is a chemical, a physical, or a psychological factor, and it can be a combination from all of those factors. And the problems that arise, it can pose a threat to the health and well-being of an individual. It's a part of everyday life, and most two people do not have the same reaction or the same response to stress. How we respond to stress is more important than knowing that there is stress, because we know that there's going to be stress, but how we respond to it makes a very big difference. We can't cure stress, but what we can do is manage our response to it, and we can manage it in a way that causes the least amount of physical and emotional detriment, and we can hope that there is some positive that comes out of treating the stress. So reflexology is really good for stress for a whole bunch of different reasons. First of all, reflexology requires no special equipment. It also allows you to be clothed without, the only thing that you do need to take off is your socks if you're working on your feet. You can, if you are working on somebody else's feet, you can use something similar to a lazy boy chair, something that reclines. You can also use something called a zero gravity chair, which is like a lounge chair, and it when you lean back on it, the head goes back and the feet go up. So it provides the person in the chair a very comfortable position for lying down. It's comfortable for their back, it's comfortable for their body, but it's also comfortable for the practitioner because your feet are at a very good level. What you can do is you put a pillow on top of the chair and they can put their feet on top of that, and that gives you a really nice place in which to work. A nice sort of body mechanics are good for that. They do make specific reflexology chairs. They're called Lafumas. They're pretty expensive, and I found that the regular zero gravity chairs work fine. So a little break. Does anybody have any questions? And you can probably, the best thing to do is just unmute yourself and ask, because I can't see everybody.
I have a question.
Sure.
So, because I had a radical mastectomy, can I do reflexology on that hand or not?
You know, that's a good question. I think that probably you could do reflexology on that hand. I think you would probably work gently and not for long sessions. The other thing that you could do is have somebody do reflexology on your feet. And that would be far enough away from the lymphatic system that it wouldn't, that it would be okay. But that is a good question.
Thank you. And I'm a nurse too. So Michelle, I appreciate this.
Good, very good. And I can only see one line of people. So if anybody has any other questions, just ask away. Okay, no questions. Okay, so we are going to get started. So I think what we'll do is, since most people are going to be doing self-reflexology, I'm going to show you doing reflexology on your hands. I also, when we're done with the hands, I will show you reflexology on the feet, and I brought some extra feet not attached to legs with me, and we will go ahead with that. So what we're going to do is the first thing we're going to do is learn something called thumb walking. That's a lie. That's not the first thing we're going to do. The first thing we're going to do is I'm going to tell you which reflexes we're going to work. So we're going to work the diaphragm reflex, the lung reflex, the solar plexus reflex, and the adrenal gland reflex. Now, I may use those words. I may say, do the solar plexus, do the diaphragm. Please know that the actual organs are not, I know that you all know this, the actual organs are not in your hands and your feet, and I may forget to add the word reflex. But when we're working on these things, I'm talking about the solar plexus reflex, the diaphragm reflex. So those 4 reflexes are the ones that are responsible for a lot of the stress and that will help us in alleviating the stress. And then if we have time, we're also going to work on the shoulder and the neck and spine reflex, because both of those areas tend to hold a lot of stress. There are also a lot of other organs and parts of the body that hold stress, but I think that for the purposes of this, those would be the things that might be best served. We are going to learn thumb walking. So take your thumb and lift it up like this, and then bend the first knuckle. And then what you can do is place it on your hand, and we are going to walk like a caterpillar. So just really gently, you're going to walk on your palm. And as you're doing this, you're taking, as we call it, small little bites. So instead of doing the same area over and over again, you're moving very slowly in a direction. And that's thumb walking. And I'm going to give you guys a little bit of time to practice the thumb walking. If anybody wants me to look at their thumb walking, maybe send a little kebab thingy, and I'll find you on the the top thingies that go across. So yeah, so we're just thumb walking. Now, as you're doing this, you can work on your pressure. So you can see whether or not you need to be pressing down a little bit harder, whether or not what you're doing is uncomfortable, in which case you'd ease up a little bit. The other thing too, which I forgot to mention, is that if you have long thumbnails and long index fingers, this is probably going to be a little comfortable. So if you want to go take a scissor and cut your index and thumb fingernails down a little bit, that might be a little bit more comfortable. Okay. We're just working.
Does it matter which hand?
No, it does not matter which hand. We can, so usually in a reflexology session, that's actually a very good question. In a reflexology session, what we do is we work both the feet. So I'm gonna use my feet here and show you. So anything that's above the toes is symmetrical. So if you look at your head, you have 2 eyes, you have 2 nostrils, 2 ears, everything is symmetrical. You have different lobes in the brain, but for the most part, everything is symmetrical. Once you get below the neck, things start to change. So you have 2 lobes of lung on one side, 3 lobes on another, the heart's on one side of the body, the liver's on another side of the body. So different organs are represented on each of the feet. Everything is same above the toes. Once you get below the toes, you have different things. So on the, sorry, I'm having a moment here. On the right foot, you're gonna find your liver because that's where your liver is located. On the left foot, you're gonna find a little bit more of your stomach. You're gonna find your spleen. You're gonna find different things on each of the feet. So as reflexologists, we work both feet to make sure that we cover the complete body. And thank you for that question. So we are going to work both hands, and for the most part, it's pretty much the same on both hands, except I will show you a little bit of a difference for the adrenal gland. So the first thing we're going to work is the diaphragm. So the diaphragm, if you know where that is in your body, it's a little bit below your breasts, and it helps with breathing. So if we relax the diaphragm, we're going to enable our breathing to be a little bit better. We're going to enable our lungs to expand a little bit better. So as we're working the diaphragm, I'm going to talk a little bit about the importance of breathing. So I'm going to attempt to share a screen. And you all can see, oh, I wonder if the diaphragm's not on here. Oh, wait, here we go. So see where my cursor is? This is where the diaphragm is. And what I've done is I've also drawn it on my hand so that you can kind of see. So there are sometimes different pictures of where the diaphragm is, and there are different pictures of where all the organs are in the body. If you look at 10 reflexology charts, surprisingly, you're going to have 12 different areas of location. For the most part, everything is grossly the same. In some of the areas, the diaphragm is listed as more of this way and then headed down that way. But I think if you work just this area, that would probably be okay. So I'm going to take this off screen sharing so I can show you guys where we're going. Okay, so I have drawn on my hand where the diaphragm is, although we may make a little bit of a different line there. It's kind of over there. So what I want you to do, and you can start with either hand, is take your thumb. And I think it's easier to start on the out. So I'm using my left hand as the hand I'm working on, and the right thumb as the thumb that I'm working. And can you guys all see me okay? Yes? Okay. All right. I'm just going to move back just a little. Okay. So what you're going to do is you're going to take your thumb and you're gently just going to walk across the diaphragm line. And then when you're done, you can go back and do it again. And you can feel, so as you're doing this, be aware and be conscious of a couple things. First of all, breathing. So, I mean, we obviously take breathing for granted because it's an automatic thing that we do. But I think sometimes, especially when we're interested in reducing our stress, we need to really focus on our breathing and visualize our lungs expanding. So what I like to do when doing reflexology is really concentrate on breathing. And sometimes when you're working on yourself, concentrating on breathing and learning how to do thumb walking and figuring out what you're doing is a little bit tricky. If you do get the hang of it, as you guys probably know, just breathing slowly in through the mouth, in through the nose, in through the nose and out through the mouth is a really good way to help oxygenate and help calm a little bit. So we've been working from the outside to the inside. What you can do, although it's a little bit trickier when you're doing it by yourself on your hand, is now take your index finger from your right hand and work the same way, but in the opposite direction. And if logistically, like body mechanic wise, it's too hard to do that, it's totally okay to keep on going in the same direction.
I have a question for you.
Sure.
So are you just using the thumb without the index finger behind it?
Thank
this
you. Yes.
like I'm
Okay.
pinching you,
So let me,
and
so
that's
thank you. That was one of the things I
better.
wanted to show you. Thank you for reminding me. So I've got my thumb here, and let me show you how my hand is being held. So my hand is being held like this. One of the reasons is to support the hand. The other reason is because what else are you going to do with your fingers? If they are just hanging out, then it's going to be much harder for you to sort of feel connected to your hand. So you're going to be holding on and you're not going to be grasping really hard. It's almost a place for the rest of your fingers to rest. So they're kind of resting there, and I'll just turn around so you can see. And they're just holding on over there. Thank you. I love these questions because you're all reminding me of things that I'm supposed to be saying. Now, again, when you turn around when you go from the opposite direction, it's a little bit trickier because you've got all your fingers in the front, but you're just using your index finger. And on the back, your thumb is kind of just holding on there. And again, if it's too difficult to work the index finger because of the way the situation, it's totally fine to just work it in the other direction. And we're just going to switch, since we've done that hand, we'll just switch and go to this hand. And it's the same thing. You're just working across.
I have a question.
Sure.
Should you be sitting a certain way? Should you have your feet, your legs a certain way when you're working on your hands?
Also a good question. So the best way usually to sit is to make sure that your feet are on the floor. You shouldn't, in terms of the way the energy flows, it's good to have your feet planted on the floor. This is also really important if you're working on somebody else. If you're picking up any energy from them, and I know that there are some mixed feelings about this, but if you're picking up any energy, you want it to be able to go through you and out. And if your feet are not on the floor, that's not going to happen. So feet on the floor, but then also probably whatever position is more comfortable. If it's comfortable for you to place a pillow in front of you and lay your hand on the pillow, you can work with your hands. I'm going to just move the screen for a second. I don't know if you can see that, but you can just put your hand flat on the table and work like this. What you don't want to do is you don't want to position yourself in a way that causes your shoulders or your neck to become uncomfortable, because then that kind of defeats the whole purpose, because then you have more stress because something hurts. Okay, so we've now worked the diaphragm. So we've kind of loosened up our diaphragm a little bit. And now what we're going to do is we are going to work the lung section. So your diaphragm line is right here, and your lungs, of course, are right above it. So on the hand, and this is something else that I forgot to explain. I'm forgetting to explain a lot of things. If you look at the way the body goes, the glands and organs in reflexology are located in the area of the foot that corresponds to where they are in the body. So your toes are responsible for everything that's in your head. And if you think about it, that's the top of your foot, and this is the top of your head. So the big toe is responsible for things that go on in the brain, and the little toes are fine-tuning for everything that goes on in the brain. The eyes and the ears are also taken care of by the toes. Anything that's in the torso has to do with the organs that are in, anything that's in the mid part of the foot has to do with the organs that are in your torso. So it makes sense that the brain is taken care of at the toes, and that your diaphragm line is here. This is your diaphragm, and then your lungs are going to be above that. So on your hand, the lungs are the area right above the diaphragm. And we're going to do the same thing that we just did. We're going to work that area. And this is going to feel a little bit more fleshy than the diaphragm. And you can work it both ways again, and we can work it that way.
May I ask a question?
Sure.
How has this been established? Are we talking about nerve endings?
So there is some, again, 10 people, 12 schools of thought. There are some thoughts that it is nerve endings. There's some thoughts that it's energy that flows through, and by doing this, you're making the passageways easier, which again relates to the nerve endings. And we're going to switch to the other side. We'll go, wait, so we'll go this way. And everybody's doing some nice slow deep breaths. Okay, and then we can just go backwards. Okay, now we are going to find a trickier spot. So now we're going to try to look for the adrenal gland reflex. So the adrenal gland is one of the main holders of stress in your body. It releases adrenaline. It's the fight or flight gland. And when you're stressed, the adrenal gland is going to be uncomfortable, and it also needs to be worked on a little bit. This is one of the reflexes that you always know when you hit. When, as a reflexologist, you always know when you hit because it's always really uncomfortable. So it's a little trickier to find. Now, the adrenal gland as a gland in your body is located above the kidney. The kidney is higher on the, why am I having like a, okay, the kidney is higher on the left foot. So on the right foot, the adrenal gland is going to be a little bit lower. So we're going to look on the left hand first. So we're going to go down from the index finger and then across to the thumb, and right about there, maybe a little bit lower, you're going to take your thumb and it's going to sound weird, but you're just going to try to dig around a little bit until you find something that hurts, which is usually not what we try to do. And you may have to use a bit of pressure with your thumb, and remember you're using the top of the thumb. And if you can't find it, just roll around a little bit. So I have definitely found mine. Mine is right, I don't know, you can't see it, it's right there. And if I press it, I can feel that it's uncomfortable. It's more uncomfortable than anything that we've worked on yet. So what you can do, and if you can't find it, it might be a little bit difficult to find by yourself on your hand, but just kind of root around there a little bit. And what we're going to do is press with your thumb for about 30 seconds. And while you're doing this, you're taking slow, deep breaths. And as you're pressing, you can also just sort of rotate your finger a little bit. Sorry, rotate your thumb just in that area. Then we can switch to the other side. So remember, on the right side, it's going to be a little bit lower. So we're going down the index finger, across the thumb, and it should be somewhere around there. And even as a reflexologist, sometimes I still have to root around and try to find where it is. And then when you think you find it, just put some pressure on there. And again, you can just gently move your thumb around, see if you can get a better sort of grip on it. Just for about 30 seconds. And remember, concentrate on your breathing.
Can I ask a question?
Sure.
So I'm very new to reflexology.
Okay.
And I realize, we're going through some of this, different points on the hand right now.
Mhm.
Is there a order of which things should be done, or are you like, from a reflexology perspective, if you have something like funky going on with, your lungs, so to speak, you're just focusing on that? Or is there a suite of touch points each
So
time?
exactly. So what we're doing today is I am just going through parts of glands and organs that are on your hands and on your feet that are mostly related to stress. If you had something funky going on, like if you had if you were having some digestive issues, we would work on all the glands in the body. So that's the pituitary, the adrenal gland, the hypothalamus, all the different glands, because those are all secreting different types of hormones. You'd also work on the stomach, the pancreas, the small and the large intestine, lungs, because the lungs are an organ of excretion. So depending on what's going on, there's usually a whole different type of routine that you would work on. So in answer to your question, if you're having breathing issues, you're not just going to specifically work on the lungs, you're going to work on a bunch of different things that assist the lungs in what they do. Does that help?
Thank you. Yep,
Okay.
that helps a lot. Thank you.
So this would be a good time to pause, because I obviously have forgotten to pause so far, but anybody else have any questions so far? All good? Okay, so we are now going to go to the solar plexus reflex. So you're going to go take your middle finger and go down kind of right to the middle of your hand. And if you put your finger there, you're going to find, so you might want to try to relax your hand a little bit. You're going to find almost like a little valley. So the solar plexus, if on the body, it's located right in the center of your chest. And it's really, really good for helping with relaxation. So what you're going to do is you're going to go down, middle finger, kind of to the center, relax your hand so you can really get your your thumb in there. It's not going to be painful, but it might feel a little bit strange, and that's totally okay. And this is another place where you want to really just concentrate on being in the moment, on taking slow, deep breaths. So when I'm working on somebody, this is usually how I end the session. And what I do is, and I usually work mostly on the feet. So what I do is, as they're taking a breath in, I ask somebody to take 3 slow, deep breaths. I press gently on the solar plexus as they're inhaling. And as they're exhaling, I release. And then I repeat this 2 more times. Press the solar plexus while they're inhaling, and release as they're exhaling. And 1 more time. So the solar plexus is also something else that you may need to just root around a little bit, but it's another, again, one of those things when you find it, you'll probably know it. And I know just personally, I can find my solar plexus much more easily on my left hand than I can on my right hand. I've no good reason why that happens, but so just kind of in the middle. And this is also a good thing to do. And you can do this, and you can do any of the hand reflexology anytime, anywhere, because it requires no equipment. But this is the solar plexus reflex is a great reflex to press if you're just sitting somewhere and you just feel like you're really stressed out. Just press this and take some slow deep breaths, and it really, really helps sort of get you recentered. And because this is pretty important, we're going to do the same thing on the other hand. Go down, third finger, right in the middle. And I'm going to relax my hands so I can kind of get in there and press. And then press again. And then one more time. Those are some of the reflexes that you can work on for hand reflexology. For working on yourself, you could be working on somebody else also. Some other things that are also good just to kind of get the hands warmed up, and probably something we should have done before we even started with the thumb walking, is just taking your fingers, taking your thumb again. Your thumb gets a big workout here, and just kind of, we don't like to say the word massage because massage and reflexology do not usually go together, but just sort of working up your palm, and then you can turn the other way, and you can work from your the tops of your palm to the bottom. And then you can do the same thing on the top of your hand, and I'll try to get it better. You can do the same thing here. So, and you can do this between your knuckles. And instead of just doing this with the index finger, you can do this with 3 of your fingers. And that just helps sort of relax the hand a little bit. And we can do it on the other hand too. And then here. Okay. So I think what we'll also work on is I'll show you where the shoulder reflex is, and then I'll also show you where the neck and the spine reflex is. So we're getting a lot of work done on the top of the hand here. So the shoulder reflex is right below, right at the base of your finger. So it's right along here. So if you think about where the shoulder is in your body and where your shoulder muscles are, they run right across the back, which is consistent with where they are in your hand. And a lot of people hold, whether they know it or not, they tend to hold a lot of stress in their shoulders, and that you get tensed up, you scrunch up, and then when your shoulders are sore, your arms get sore, and then your neck can get sore. So what we're going to do is we're going to try to take care of some of the problems that the stress causes that are visible to us. So same thing, we're going to do the thumb walking, but instead of where we were with the lungs, which is really sort of on the fleshy part, we're going to go closer to the base of the fingers. And we're going to do the same type of thumb walking. And then we can also reverse. And also if your shoulder is kind of tight, if you're having a little bit of tightness in your shoulder reflex, not the muscle, the shoulder muscle reflex is here. And that's sort of the upper back muscles, but your actual shoulder muscle, sorry, your shoulder reflex is right here. So what you can do is just take your thumb, sorry, it's a little bit washed out here, and just work your thumb on the base of your pinky. And you can also just take your index finger and your thumb and just rotate a little bit and just move it around. Now, at any point, if you're doing reflexology and something hurts and it doesn't feel good, just stop and then just sort of figure out if maybe your hand position is incorrect, if you feel like you're pushing a little bit too hard, just reassess the situation. If something hurts, except for maybe the adrenal gland, you shouldn't do it. You just kind of have to draw back and reassess what you're doing. So that's your shoulder, and we can work same thing over here. Go back this way. And then we'll just work the shoulder a little. Just move back and forth. Okay, any questions so far? Okay,
Yes,
let's.
Michelle.
Oh, sorry,
we
go
did
ahead.
have a
Yes.
question. This is Lisa. We had a question from one of the participants. It says, for those of us with neuropathy, essentially dead or deadened nerve endings in our hands and feet, is this effective?
So I have to say that when the center was open and I was seeing people, I would say that at least 30 to 40% of the people who sat in the chair had some form of neuropathy. I don't think it's long-term effective, but I think that it does not hurt. And I know that after I'm usually done with a session, people usually say, that feels so much better. It lasts maybe a day or two. So anytime that you're going to be increasing the circulation and increasing the blood flow to an area, that's going to be helpful. So you can totally do this on your hands. You can work your fingers just like this. You can take your thumb and work the tips of your fingers. And you can work the sides. You know, your hands are just amazing things. And I bet before today, you didn't know that you could do all these wonderful things with your hands. And you could just go work and with your thumb, just with that first knuckle going back and forth like a caterpillar. You can rub it a little bit. Another thing too that I find really helpful is it's called a spiky ball. And what you can do is you can put the ball between your hands, and you can just roll around like this. It's a little bit more difficult to do on your fingertips, but if you're doing it on the palm part of your hand, then you're stimulating all of the organs and glands that are located in your torso.
Michele, do acupuncture points correspond to reflexology points?
You know, they don't. Acupuncture has points that are a little bit different. I know that, you know, you have something that you can hit behind your knee and it's your gallbladder or something like that. I don't think that there's a lot of points that are consistent with each other, but I do not know that much about acupuncture. I do know that acupuncture is very effective in treating some things. But I don't think that the points are exactly the same. I know that they put stuff on your neck and your ear for weird parts of your body, for hot flashes and things like that. I don't have an answer to that because I don't have the knowledge for that. I'm sorry. Okay, so we have the rolly ball, which is really effective. Let's do the neck now. So on your hand, your spinal column, which if you, of course you know, it's located in the center of your body. So if you put your hands together like this, you could see that your spinal column is going to be right around here. So what we're going to do is we're going to work from the base here. So this is sort of the last of the L's. So there's the cervical, the thoracic, the lumbar, and the sacral. Cervical starts at the top, goes down to thoracic, lumbar, and sacral. So we're going to work the spine, and it's along the base of the palm, and it goes up kind of in the fleshy area of your thumb, and it goes along the side of your thumb. And you may notice that there are some little areas as you're working up that are uncomfortable, and this is related to your spine. And here's one really important thing that I forgot to say. So if you're working on your hands or your feet, or you're working on somebody else's feet, and they're like, ow, that hurts, ow, that hurts, it doesn't necessarily mean that there's something wrong with that part of their body. It could mean that they've worn a pair of shoes that's kind of funky on their feet. They were walking and kind of stepped off a curb. It doesn't necessarily mean that pain in the hands or the feet is definitely related to a pain in a specific organ. That's kind of an important thing, because you don't want to freak out about anything like this. And so this is all the way up your spine. Right here, this is called C7, and this is your neck vertebrae. So can't really get a good picture there. So it's below the first knuckle bend, and it's right there. And you can just take your index finger on one side and your thumb on the other, and just kind of massage. Oh, I said the word again. Put some pressure on those areas, and you can rotate a little bit. That's also good if you feel like you're having a little bit of a sore neck. So this area, in combination with the shoulders, that can usually release some of the stress and tension that we hold there. And just like that. There's another area that's good for stress and tension, and it is the area between the index finger and the thumb. Nope, that won't work. And you take your thumb and put it sort of on the, almost like the webby part, but a little bit more to the fleshy and the back, and you just press. And again, deep breathing. Deep breathing is always good. It's always good. And if you want, you can take your thumb and press it a little bit further back. So you're instead of pressing down, you're pressing a little bit at an angle. And again, you press to what pressure feels good for you. If you feel that it's uncomfortable, then of course draw back. If you feel like you're not feeling anything, move your hand around a little bit, and you can use a little bit harder pressure to see if you can sort of elicit any type of a response. Okay, questions so far?
Yes, we had another one from a participant. This is Lisa
Okay.
again. I have a lymphoma and have enlarged lymph nodes under my arms and on my neck and head. What area of reflexology would help relieve the pain and get blood flow to the areas?
So probably the best thing to do would be sort of a whole session with just working all of the areas of the hands and the feet, or if you're just working on the hands, just work all the areas that we were talking about. Also, between the first finger and the second finger, right here is a lymph release, and you can press that. And what you do is you put your finger on the palm side and your thumb on the other side, and just press that a little bit. Just like that. And then also working the sides of the fingers. It's also helpful, and you can do that for all of your fingers. And then also, and this is kind of a strange area, on the front of your wrist right here, you're going to work straight across. Just like. Okay, I think we'll do a really quick review of feet. Let me just see if there's anything that I've missed on my little cards here. Okay, so the same things apply to the feet. You're going to be doing the same type of thumb walking. And what you do is, so if this was the left foot, you're going to take your hand and hold on to the person's foot like this, so that you're supporting the foot, but also supporting your hand. And you would do the same type of thing where you thumb walk across the diaphragm. And then you could thumb walk across the lung area. Remember, the lungs reflexes on the ball of the foot. And the other thing that you can do, which I think I neglected to say on the hand, is when you're working the lung area, you can also, in addition to working horizontally, you can work vertically. And you just move over slightly each time and do the thumb walking on the top. If you're working on somebody's feet, you may find that you don't have as much, it's a little bit more difficult to work on because maybe their feet are a little bit dry. So even though we don't really recommend using lotions or anything like that, again, ask 10 reflexologists, 12 different answers. You can use a little bit of lotion, or some people actually even use Vaseline, and that just makes the flow of the finger a little bit better. The other thing too is if you're really having trouble with the thumb walking, instead of it, just take your finger and kind of run it across. It's not going to get the spots as nicely as thumb walking will, but it's better than not doing anything at all. So you can just run your fingers across there, just like that. You'd work the shoulder the same way that we did on the hand. Same thumb walking thing. And the solar plexus is the same thing, except the difference when you do the solar plexus on the feet, if you're working on somebody, you do it at the same time. So you would hold your thumb is on the solar plexus, and you'd have them take deep breaths, and you press the feet towards them, and as they inhale, and as they exhale, bring the feet back, and you do that 3 or 4 times. This usually feels really, really nice. The adrenal glands, same type of a press there. You would just press and just kind of, although wrong hand, press and just rotate around a little bit. What you can do too for working out the neck on the foot is the neck is right, the little sort of indentation of the toe, the big toe, and you take the finger and just kind of rotate around there. Also, what you can do, although this foot is not very flexible, you can rotate your toes like this, and you can do each toe individually, and that kind of feels nice too. And you of course can do the same thing on the hands, where you can just relax your hand and rotate your fingers just like this. And of course, working the sides of the fingers are also good. It's like this. The same thing here. Does anybody want better explanations on the feet? Sorry, we kind of rushed through that a little. No, okay. Any more questions?
Yes, ma'am. We have a couple more.
Okay.
All right. That spiky ball that you were using, is that hard or soft? And where can someone get one?
So this is a combination. This is this is a hard rubber, but it feels very comfortable. And I just happened to order a couple more on Amazon, and I don't think I'm wild about them. So this is a little bit bigger, and it's not as spiky. I feel like the spikes are better on this. And this is hard as a rock. And I didn't initially like it, but now I do. I think they're just called spiky balls, and I think you can just get them on Amazon. I think it was like $5.99, and this one was called the Therapist's Choice. This one I bought at a reflexology conference, and I could not find anything similar to this. If I do find it, Lisa, I will send you a link to it, and you can send it out. This is my favorite one. So you can do this on your hands like this. The other thing you can do, which is really, really, really nice, is use this on your foot. But here's the big caution. Don't stand up and use it on your foot. So sit down with your shoes and socks off, put this on the floor, and put some pressure on your foot, and just move your foot around and let these spikes go all over your feet. It feels amazing. It feels amazing. Just a thing. Okay.
Perfect, thank you. Next question was, any ideas for the pelvic region? Uterine cancer and several surgeries quite damaging, and she's kegeled out.
Okay, I understand that. So pelvic region, so what you would want to do is you'd want to work the lower area of the spine. So that would be closer to this end down here. And you also probably want to work on your bladder. And I gotta say, I'm not really familiar where the bladder is on the hand, because again, I work more on the feet. On the feet, your bladder is kind of in this area over here. And you would want to work up this way and all along here. And really anything that you do with the spine will also be helpful. So that's the bladder and the uterus. That's all sort of in the same area, and they're all related to each other. Also, on the feet, again, I'm going to check the chart to see if I can find the bladder on the oh, okay. So the bladder, that makes a lot of sense. So you're going to be working your spine, and then the bladder is going to be here. So the bladder is in the lower lumbar part. So you're going to be working here if you're working on your hands. And then again, if you're working on the feet, the uterus, even if you don't have it, you can still work on it. It's right along here. And I think we can, you know what, I'm going to bring up the chart, the foot chart, and I'm going to show you where it is on the foot chart. That's easier. So the uterus is on the medial side of the foot, the inner side of the foot. And it's a small little area. And even if you've had a hysterectomy, it's still actually one of those areas that's painful because it's one of the a hormone producing organ. So it's really, that's another one of those areas that you know when you hit it, because usually the person makes just a tiny little hole in the wall when you've hit this area. And even if you don't have a uterus, you can still work on it. And just, you would sort of dig your thumb in there and just move it around a little bit. The fallopian tubes and the ovaries are on the, let me see, where's the outside? Sorry. It's on the same spot, but on the outer part of the foot. So the uterus is, oh, hold on, let me unshare the screen. So the uterus is on the inside of the foot and the ovaries are on the outside of the foot. But for any type of pelvic cancer, working the bladder is good, working the lower part of the spine is really good, and also working the female organs, good.
So what does this do for the bladder when you do this reflexology on that part?
Well, it just, again, from what I said in the beginning, and it just kind of gets your body to heal itself. And it just helps sort of get everything more in alignment. It's not going to cure any of the type of cancer or anything like that. It may make you more aware of the bladder, may make you more aware of urges for urination.
All right. Do you have time for some more, or did you have more material you'd like to move on to?
No, I think I've covered everything. I may have covered.
Okay. This kind of goes along with a question I had as well. If you're working on certain parts of the body that there are pressure points on both hands, should you always do both hands or just the one hand? Like, for example, the uterus, are you supposed to do the inside of both feet, or do you just work on one side and then you're done?
You know what? That's a good question. I think it's a good idea to work both feet. If you're talking about an organ that's symmetrical, I think it's always a good idea to work both. Like if you're talking about, your adrenal glands, you should work the adrenal glands on both feet. I think if it's possible, it's good to do it symmetrically. And even if there's
Okay.
one organ, so if you're talking about the bladder, so that's actually a very good question, because the bladder reflex, if you think about where your bladder is, it's in the center of your body. So there's actually a bladder reflex on both feet, and it's on the same area on both feet. So it's here, around here on your right foot, and it's on the same area on your left foot. So that goes sort of with the same idea, with the uterus being, again, in the center of your body and being on the inside of the foot here and on the inside of the foot here. So if you put your feet together, the uterus is in the center and the bladder is in the center. I hope I'm not confusing anybody.
No, that makes sense. Another question, is there any way to rid cysts from the arches of your feet via reflexology?
I'm sorry, say that again.
Is there any way to get rid of cysts on the arches of your feet using reflexology?
So the arches of the feet. Does this person have any GI issues?
It's my question. It's Sandra. I wouldn't say I have GI issues. But
Okay. Are the cysts new? Have you just noticed them, or have they always been there?
5 years, but they don't seem to shrink. They just seem to, they've grown a little bit, but they've just stayed pretty much the same in the last year or two. I just, they're unsightly. They're in the arches of my feet.
And are they uncomfortable at all?
No, I don't feel any pain.
Okay.
I've gotten rid of the shoes that used to rub on the arch. I got rid of any shoes that would cause any friction on the arch.
And Sandra, you're on your feet a lot too, right?
Yeah, that's it. You're right. Thank you, Lisa. I am.
Yeah.
Okay. And did you notice that you had the cyst after you had changed shoes?
Maybe one pair of shoes after I got rid of some that were clearly the culprit. Then I maybe had one other pair of shoes that right away I'm like, this is not good. So since then, I just didn't know if there's any way. I don't want to do surgery, but just was curious if reflexology can, get that cyst to melt away.
I think there'd probably be no disadvantage in trying it, and you can start with your hands and work on your hands in the area where the cysts are related to on your feet. And then you can also try working on your feet just really gently around the cyst. Now you may not, I'm just going to make believe like this is a cyst over there. You may not want to press directly on it, but you can kind of work around it.
Oh,
and see if that makes any difference.
Yeah, thank you. That resonates. Sure. Thank you.
Sure.
We had one more question, which is good timing. Is there anything one can do for inner ear pressure, probably caused by infusions for cancer?
Okay, we did not discuss the ears at all. So the ear reflexes are at a little bit above the base of your 5th and 4th finger. So what you can do, again with the thumb walking, is thumb walk along the base of both of these fingers. And then in addition to that, although you can't see, work the sides, the base of the sides of the fingers. kind of in that area. And I think too, when you're working on the ears, you may want to just use a little bit firmer pressure than maybe you're using in other areas. So again, here and here. This is really, again, I work more on the feet than the hands, but I know that if someone's got something going on with their ears and I'm working on their feet and I'm pressing around here, it's pretty obvious to them when I've hit the ear spot or when I've hit the spot that they can, you know, I'll say, is there something going on with your ears? And they'll say, yeah, it's clogged or something like that. So this is a good area. And I know that sometimes it's really hard to work on your own feet just because it's hard to get your foot in a position depending on how flexible you are. But if you can work on your own feet, that would be, the ear would be a good spot to work on. So on the base of the toes, just there, and then also along sides of the toes.
Does anyone else have anything else they'd like to ask Michele?
I do. Michele, what do you find any digestive problems, like swallowing or getting food down? And if you've got problems with your esophagus, what would you do?
So is it related to a treatment?
No, it started before the treatment.
It started before the treatment.
Right.
So on your foot, the esophagus reflex is right here. So the way you work that is you start a little bit below the diaphragm line and then work between the first and second toe. So that's the trachea and the esophagus. So you can work that area there. And then also you may want to work some of the glands and some of the hormonal things, because you want to increase your elasticity there. And this is probably more advanced than something that we can get into here. Except for the adrenal glands and some of the uterus, we didn't get into the glands. And the glands are important, but they're also really specific where they're located on the foot. So I didn't think that would really be a good thing to do. But you can do work on anything that has to do with elasticity. So that would be some of the glands. You can also work on the esophagus and also the back of the toe right here. Mm-hmm. And the front of the toe, that's the throat area. And also you can work on the side of the toe too, both sides of the toes, and that might help a little bit. And also the top part of the spinal cord, right around here.
Okay.
Michele, is there a regimen you would suggest, like daily, weekly, hourly?
So, if you're working on stress, and since you're not doing a really intense session and you're not pressing really, really hard, you can do that whenever you like. I mean, I don't think you should do it 10 times a day. And if you are doing 10 times a day, you probably need to find another way to deal with your stress. But I think it's okay to work on it daily. Just go through sort of those areas, the diaphragm, the adrenal glands. The adrenal glands I might maybe just do every other day, not every day, but certainly the lungs and the diaphragm and the shoulder. And if you're having problems with your neck and holding tension in your shoulders, you can just do that wherever you're sitting at a stoplight. You can just kind of work on your neck a little bit. You can work on your shoulders. I don't think that there's really a limit, but again, probably not more than a couple times a day in terms of just these very general hand reflexology stress reducers.
Well, this was amazing. It was so nice to see you.
This
we
was
look
really
forward
fun.
to when we can see you back in person.
I'll be so excited about that. And everybody's questions were really, really good. They were really good, and they did a really good job of reminding me of the things that I had forgotten to tell you. So I appreciate them.
This is the one
Yes,
time.
and like we mentioned in the beginning, if you do have any further questions, feel free to reach out to Michele.
Great. Thank you, everybody, so much. Thank you.
Thank you.